So the print's a little smaller here, but the font. But I'm going to present the results of the ECOG-ACRIN E1910 National Clinical Trials Network clinical trial. This is a phase 3 randomized trial of blinatumomab for newly diagnosed BCR-ABL negative. We also refer to the BCR-ABL gene rearrangement as a Philadelphia chromosome. So these patients were negative for this finding, but they had B lineage acute lymphoblastic leukemia. Acute lymphoblastic leukemia is the acute leukemia counterpart of what Dr. Brown just told you about with chronic lymphocytic leukemia. And these are the cells that we worry about. These are the blast cells that don't function well and cause these patients to develop infections and bleeding and can be fatal if not treated. So the molecule we were testing is blinatumomab. This is a bispecific T-cell engager molecule. You can see on the left that it combines the variable region of two antibodies, one directed against the CD19, which is on the leukemia cells, and the other is CD3, which is on T cells. There's a linker that combines these two variable regions, and so this molecule brings a T cell, a normal T cell, a part of the immune system, in proximity with the leukemia blast cell and kills it. And this is the mode of action of this immune therapy. Blinatumomab is already approved in multiple countries for the treatment of relapsed and refractory acute lymphoblastic leukemia, and also in patients that have measurable residual disease positive acute lymphoblastic leukemia. Here we aim to test it in patients who are MRD negative, because we know that even though we can't find leukemia in these patients' bone marrow, it's still hiding there, and they can often relapse during their treatment. These trials are complicated in their design, and I've tried to simplify that here. Patients underwent standard induction chemotherapy to induce a remission. This lasted for about 2 months. They then had a 1-month course of intensification treatment to give chemotherapy to get into their central nervous system to prevent the leukemia from getting in there and causing disease. At that point, they were randomized, and as you can see from the asterisk at the bottom, we did testing for measurable residual disease. So the standard definition of a remission in acute lymphoblastic leukemia is to have less than 5% blasts in their bone marrow. When these patients present, they often have 80 to 90% blasts. However, within that small amount of leukemia, there can be a small amount of blast cells, there can be leukemia hiding there. And so we now have sensitive techniques to look for these low levels of leukemia. But again, some of these patients, we can't find it. So this is when we say they're measurable residual disease negative. So the patients were randomized on the right to get the standard treatment, which is consolidation chemotherapy. We're consolidating the remission that we've achieved, and they get that for 4 monthly cycles. They then can go on and get maintenance chemotherapy, which can last up to a year or two, and their total course of treatment, as I said, is 2.5 years. The experimental group got blinatumomab for 2 cycles, and blinatumomab is given intravenously, and it's infused over a month. So patients wear a pump and are able to be an outpatient and be mobile and up and about, but this is infused continuously for 4 weeks. So they had 2 cycles of that. Then they got the consolidation chemotherapy, just like the patients in the control arm, and then they got 2 more cycles of blinatumomab toward the end of that, and then they went to maintenance chemotherapy. And patients could go off and have a bone marrow transplant if their doctor felt that that was in their best interests. So what we showed was the patients that got blinatumomab plus chemotherapy had an improved survival over those that got the standard chemotherapy. So the black line is the patients who got the blinatumomab plus chemotherapy, and their overall survival after 3.5 months of follow-up, this was a median follow-up, was 83%, versus in the red curve, you can see that this was at 65% at 3.5 years. And you can see that the red curve is continuing to go down, whereas we seem to have a plateau in the black curve, and we hope that that means that these patients will continue to remain in remission and be cured. And you can see the hazard ratio is 0.42, with the confidence intervals 2.24 to 0.75, so it did not cross 1, and this led to the statistically significant result of a p-value of 0.003. So in conclusion, This trial, E1910, showed for the first time an overall survival advantage for adult patients who are MRD negative with BCR-ABL negative B-lineage acute lymphoblastic leukemia when blinatumomab is combined with their chemotherapy. And we feel that this represents a new standard of care for these patients and should be incorporated into their standard therapy. Thank you.